on the American Health Journal. The knee is a remarkable mechanism, but with wear, aging, or arthritis, pain can become unbearable. Fortunately, there's a partial knee replacement surgery that can bring back mobility and relieve pain. Dr. Alan Beyer of Hoag Memorial Hospital Presbyterian in Newport Beach discusses the partial knee replacement surgery.
The most common causes of knee pain that we see today are degenerative disease, which is your basic arthritis, be it from inflammatory arthritis or just wear and tear arthritis, and probably trauma from people in sports and automobile accidents, skiing accidents, and things like that. So those probably account for over 90% of the knee pain we see today. Knee replacement becomes inevitable when the degenerative processes progress to a point where it's impacting upon a person's ability to do their activities of daily living. When people have pain at rest, people have pain just with their walking around the household even, or a block or two, that restricts them from doing even activities of daily living, is when we begin to start to talk about the need for total knee replacement or partial knee replacement. The most common symptoms we see in people with degenerative joint disease of the knee are obviously pain. That's far and away number one, but they can also have decreased range of motion. They can have swelling or water on the knee, as it's sometimes referred to. They can have a grinding sensation where they actually feel or hear noise coming from the knee when they're ascending or descending stairs, or when they get up from a seated position. And all of those things are secondary to the pain. Pain is still first and foremost the most common thing that we see in people with degenerative disease.
Dr. Beyer describes partial knee replacement surgery.
The knee is basically made up of three major compartments: the patellofemoral compartment, which is the area behind the kneecap, and the medial side of the knee or inside of the knee, and the lateral side of the knee or the outside of the knee. Usually in degenerative disease of the knee, all three compartments are affected by the degenerative process. However, sometimes only an isolated compartment is involved, such as the medial side of the joint, and instead of replacing the entire knee joint with metal and plastic components, we're able to only replace the portion of the knee joint that's worn out. This is probably only applicable in about 5 to 10% of cases, but when it is applicable, it is of great advantage to the patient to have the smaller operation. A partial knee replacement, and again, it's not the answer for everyone, but a partial knee replacement allows for a quicker recovery because the surgery itself is a less invasive surgery. It involves less cutting away of the person's own tissue. It allows for the person to get back to their level of activity somewhat quicker. It also allows for the person to feel more like a normal knee. Since you're not resurfacing all of the parts of the knee, most patients who have a partial knee replacement say that it really feels almost like their regular knee, as opposed to a total knee replacement where it feels wonderful compared to how bad they felt before you've done it, but it never feels quite like a natural knee.
We asked Dr. Beyer, how long is the recovery time after surgery?
The recovery time to getting back to a pretty high level of function is usually about 3 to 4 weeks with a partial knee replacement, whereas a total knee traditionally will take up to about 8 or 10 weeks. So it really halves the recovery time in the early going. By about 3 to 4 months, you just about can't tell the difference between the two. Most of our patients will tell they can go back to skiing, maybe not moguls, but certainly groomed slopes, not double black diamonds, but certainly maybe the blues. Most people will go back to golf. Most people are able to go back to doubles tennis. The one activity that we try to recommend people not return to is repetitive impact activities such as jogging or running. I've often said to patients that if God wanted you to run, He would have given you wheels. I think that holds even more so true after a person's had a knee replacement, because the repetitive impact is probably not optimal for the wear of the components.
We also ask, how successful is this surgery?
Knee replacement today is well over 95% success rate in terms of restoring a person to a higher level of function, significantly decreasing, if not eliminating, their pain, and getting them back to the lifestyle that they really were before the onset of their disease.